Which of the following statements is not correct regarding hypertension in pregnancy? Options are: an increase above booking readings of greater than 30 mmHg systolic or greater than 15 mmHg diastolic suggests hypertension. Yes, this statement is correct. According to NICE guidelines, from booking values at any point during pregnancy suggest new onset of hypertension. Option number B, preeclampsia occurs in around 5% of pregnancies. Yes, approximately 2 to 8% of pregnancies worldwide, so an estimate of around 5% would be reasonable. Option number C, urine dipstick showing protein positive is consistent with gestational hypertension. This statement is incorrect as the presence of proteinuria, protein in urine, is not a feature of gestational hypertension, rather it suggests preeclampsia. Option number D, a rise in blood pressure before 20 weeks suggests pre-existing hypertension. Yes, this statement is true as well. Hypertension that predates pregnancy or develops before 20 weeks gestation is classified as chronic or pre-existing hypertension. Option number E, with gestational hypertension, the blood pressure rises in the second half of pregnancy. Yes, gestational hypertension refers to new onset high blood pressure that develops after mid-pregnancy, typically after 20 weeks of gestation. So above all, the correct answer is option number C. 56 years old man attends his GP surgery for a routine blood pressure check and examination. He has no immediate concerns and his past medical history includes hypertension and asthma. He feels well in himself. On examination, he appears well and observations are normal except for a raised BP of 155 by 87 mmHg. Upon auscultation of the heart, the GP notices an S4 heart sound. The GP then requests an ECG recording. Which part of the ECG does this sound coincides with? Options are: first one is P wave. Yes, this option is correct. S4 heart sound is caused by atrial contraction against the stiff ventricles, occurring just before the S1 sound. It may be heard in aortic stenosis, hypertrophic cardiomyopathy, or hypertension. As such, it coincides with the P wave, which represents atrial depolarization. Option number B, QRS complex. This is incorrect. This represents ventricular depolarization, whereas the S4 heart sound is due to atrial contraction. Option number C, ST segment is incorrect. This is simply the interval between ventricular depolarization and repolarization. It is not associated with the heart sound. Option number D, T wave are an indication of ventricular repolarization. As such, the S4 sound is not linked to these. Last option is U wave, may not always be seen. These are small deflections following T waves. There are a number of theories regarding their origin, including delayed repolarization of Purkinje fibers. These do not correlate with the S4 sound. So, the correct option is P wave. A 3 days old neonate born prematurely at 34 weeks gestation has been slow to wean off the ventilator since birth. On examination, she has been found to have a continuous heart murmur. An echocardiogram has detected a patent ductus arteriosus. No other structural heart abnormalities have been found. Chest X-ray shows cardiomegaly and mild congested lung fields. What initial treatment should be started to manage this condition? First option is emergency surgery. Surgery is generally only performed if non-surgical measures have been unsuccessful. Option number B, endomysitis. Endomysitis or ibuprofen is used in PDA as to promote duct closure. A PDA is a condition where there is a failure of the ductus arteriosus to close after birth. This results in the flow of some oxygenated blood from the descending aorta to the pulmonary artery, a left-right shunt, which can lead to pulmonary edema. It is more common in preterm infants. In the developing fetus, the ductus arteriosus allows blood from the right ventricle to bypass the fluid-filled non-functioning lungs Endogenous prostaglandins secreted by the placenta and ductus arteriosus itself usually maintain the patency of the DA. After the infant takes its first birth, increased pulmonary blood flow results in the clearance of these prostaglandins, thereby resulting in the closure of the DA, that is ductus arteriosus. Non-steroidal anti-inflammatory drugs such as indomethacin or ibuprofen inhibits prostaglandin synthesis, therefore accelerating the closure of the ductus arteriosus, and is an effective non-surgical treatment. Option number C, beta blocker. There is no role for using beta blockers in this condition. Option number D, IV fluids. IV fluids have no benefits in treating this condition and may worsen heart failure. Option number E, prostaglandin. Prostaglandin would have the opposite effect, that is maintaining the patency of the DA. They are sometimes used where a PDA is desirable, such as if there is coexisting right to left shunt effect, where the PDA may be the only way for oxygenating blood to mix with the oxygenated blood. So correct option is option number B, indomethacin. 62 years old man who had a mechanical mitral valve replacement 4 years ago is reviewed. What long-term antithrombotic therapy is he likely to be taking? Options are nothing, it is incorrect. Option number B, direct acting oral anticoagulants. These are not used in patients with a mechanical heart valve. Option number 3, aspirin. According to the European Society of Cardiology guidelines, aspirin is only given in addition if there is an additional indication, for example, ischemic heart disease. Option number D, aspirin plus clopidogrel for the first 12 months. That's incorrect. Last option is warfarin. Yes, in mechanical valves we give warfarin. 34 years old man presents to his general practitioner with fatigue and exertional shortness of breath. He has no significant past medical history and is on no medications. He does not smoke or drink alcohol. On examination, he is tall and thin. A high arched palate is noted on examination. Auscultation of the precordium reveals a pansystolic murmur heard longest in inspiration. From the options listed below, what is the most likely explanation for his symptoms? First is mitral regurgitation. This is incorrect. This also causes a pansystolic murmur, but it will be loudest in expiration. Option number B, mitral stenosis. It is also incorrect. This is a low-pitched diastolic rumbling murmur heard loudest in expiration. Option number C, pulmonary regurgitation. This causes a diastolic decrescendo murmur. This is also an incorrect. Option number D, tricuspid regurgitation. This is a correct answer. This valvular region is associated with Marfan syndrome, which is suggested by a tall and high arched palate. It is a pansystolic murmur heard loudest in inspiration.